Hey, we are Team 33 in the patient empowerment track. I am Zach Schulman here with Vamdi Chodaseti and Arman Zadeh. We are three Case Western Reserve medical students, and we'll be presenting on SimpleDoc, which is a smartphone-based app using AI to increase health literacy and reduce healthcare utilization and costs. So health literacy is widespread in the US. It leads to significant increases in healthcare costs and impacts hospital quality metrics. The total cost of health literacy is estimated to be between $700 and $900 billion in the US annually. It's estimated that patients with low health literacy are 1.5 times more likely to be readmitted within 30 days compared to controls with adequate literacy. And hospital revenue is largely impacted by HRRP penalties of upwards of 3% of CMS reimbursement for hospitals that have high relative rates of readmissions. And then lastly, hospital rankings are impacted by HCAP surveys, which are patients' feelings on how well they were communicated with. And we think that our app can improve both readmission rates and patient satisfaction, which impacts HCAP surveys.
Given the variety of incentive structures to be able to reduce some of the friction that low health literacy folks experience during healthcare, we decided to take a look at what hospitals are already doing. Currently, hospitals are spending about $24 billion to be able to mitigate some of the administrative friction that they currently that patients currently experience. And we believe that this is the first area that we would target in order to make our sales.
So our solution, SimpleDoc, uses a variety of AI tools and education content libraries to come together and provide patients with a smartphone tool that they can use to improve their own health literacy and also make them feel more comfortable in understanding the care they're given and their instructions post-discharge. Using the tools we have outlined on the left of the slide, we bring those all together, such as the content library by our sponsor, Sanctuary Health. And we brought this into a smartphone app that patients can download for free. And then the idea is patients can use their smartphone to just scan a document, use the camera to scan a document on any of the documents we outlined here, such as like an after-visit summary, a medication list, or any other informational pamphlets, or use audio recordings of patient-provider interactions to achieve some of the use cases we outlined on the right. Some of the highest yield use cases we imagine patients using this app for include simplifying medical documents to personalize literacy levels based on initial literacy tests patients will take when they open the application. Patient education support via teachback methodology and trusted content libraries, such as that by Sanctuary Health. Audio outputs for patients who have trouble reading and would rather communicate with the app via speech. And then a conversational chat interface that allows patients to ask questions on their document and get it answered. There's also built-in features that we worked on this weekend, including automatically scheduling events or reminders based on notes that are within discharge paperwork, such as if a patient has to take a medication X number of times a day, the app will offer to create reminders for that. Or if they have to perform wound care X number of times a day on these days of the week, the app will offer to create reminders and events for that. Finally, it'll provide a saved and searchable library of personal medical documents as patients continue to use the app and upload their medical documents to the app. So in the last few slides, we've outlined some demos that highlight the simplicity of the user interface and the different use cases and how the app is already working, as well as some key takeaways. But I'll leave this to the judges to look